On behalf of the Expectant in Parenting Youth in Foster Care Learning Collective and the Center for the Study of Social Policy, we welcome you to our third webinar. Today's discussion will focus on creating opportunities for expectant and parenting youth and their children through mentoring. During this webinar, we invite you to connect, share ideas, and challenge each other's thinking. Our presentation will begin shortly, but first, some important reminders. We are recording this webinar, and we will send you a link to view the recording, as it will also be posted on our website. We recommend that you listen in to the webinar through a landline. If you experience any audio problems, try hanging up and dialing back in. Due to the number of people online, all attendees are currently in listen-only mode. You can submit questions at any time using the chat feature in your control panel. We will hold question and answer sessions following each presentation. At that time, we will unmute individual participants so that they're able to ask their question. To signal to us that you want to ask a question, click on the hand icon in your control panel. This is our team. My name is Lisa Primus, and I am the one with the big curly hair. And I am joined by my colleague, Alexis, who is a new addition to our team, and her photo is directly below mine. Here's what we hope to accomplish today. We want to touch on the social developmental needs of expectant and parenting youth in foster care and how these needs can be addressed through mentoring. We want to hear from the lived experiences of a mentor and a mentee. We're also going to be learning from Sacramento County's Expectant and Parenting Youth Collaborative on their mentoring approach, which is specifically targeted to connect every expectant and parenting youth in foster care to a mentor. And at the end of our presentation, and really this is for us the highlight of the webinar, we want to have the opportunity for all the participants to share and solicit feedback on how we can create opportunities for mentoring and supporting expectant and parenting youth in creating lifelong connections. We are excited to have several dynamic speakers today. Our first presenters are going to be a mentor and a mentee duo, Oleachea and Mary Ellen Shea. Oleachea is a youth ambassador at Lawyers for Children. She's a writer for Rise Magazine, a college student, and a mother of a 5-year-old son. Mary Ellen Shea is a licensed master social worker at Lawyers for Children, and she is leading their programming for pregnant and parenting teams in foster care. Our second presenters will be the two leads of the Sacramento County Expectant and Parenting Youth Collaborative, Barbara Oleachea, a CPS program planner, and Brenda Dabney, a Sacramento One firm director at the Children's Law Center of California. Additionally, we will hear directly from 4 of their mentoring network partners. Welcome to all of our presenters. We want to take a few minutes to share with you a brief overview of our theory of change that CSSP has developed for improving well-being outcomes for expectant and parenting youth and their children. I will go over it very quickly. More detailed information can be found on our website at www.cssp.org, and also by listening to our inaugural webinar, which is archived on our website. Our theory of change is informed by both research and practice. It draws from and combines 2 initiatives at CSSP: Strengthening Families, which is focused on how parents can be supported to be successful, and Youth Thrive, which is focused on how adolescents can be supported to thrive and successfully transition into adulthood. Our theory of change is reflective of the need to support expectant and parenting youth, not just as adolescents, not just as parents, and not just on their children, but holistically as a young family. We intentionally use the word expectant to be more inclusive of fathers and to underscore the importance of father engagement and involvement. Although we still have a lot to learn about the service needs of fathers, we must acknowledge their important role in contributing to the health and well-being of their children. As you can see on the slide, the results that our theory of change hopes to achieve are thriving youth, that youth have educational success, strong, stable connections, and are physically, mentally healthy. And that they are thriving, and as they are thriving, they are better positioned to become nurturing parents. That they are able to create and maintain a nurturing environment where their children are safe, healthy, and ready to learn. In order to achieve these results, we think that several key elements must be in place, and you can see those elements listed in the orange box at the beginning of the theory of change. In addition to the elements of the approach, we believe that strategies must create opportunities and reduce risk, that both are necessary. To help you thrive, we think of creating opportunities for school-based supports, financial literacy, and constructive community engagement, while at the same time implementing strategies that reduce risk, such as trauma screening, domestic violence support, and family planning services. To help youth become nurturing parents, we think of creating opportunities for home visiting, parent-child activities, and co-parenting supports, while reducing risks by providing early remediation of developmental delays for their children. Our theory of change emphasizes the need for strategies that mutually create opportunities and reduce risk so that these young families can succeed and thrive. We have recently published a research paper that addresses the developmental needs of expectant and parenting youth in foster care and have delineated 5 key areas of need. The paper can be found and is available for download on our website. One of the 5 areas that you will see on your screen is the need of social development. This area focuses on building and sustaining relationships with trustful and supportive family members, other adults, peers, and the co-parent when it is safe and appropriate. Social development refers to being involved with social institutions and communities that are safe, stable, and equitable. It also refers to having access and receiving comprehensive services and supports that focus on the dual needs of the young parents and their children. We emphasize that these comprehensive services and supports should be guided by an understanding of adolescent development and a strength-based, trauma-informed approach. Our presentation today will take a deep dive in creating opportunities and addressing expectant and parenting youth social developmental needs through mentoring. First, let's take a look at mentoring. Mentoring can mean different things to different people. Natural mentoring are those meaningful relationships that develop organically between youth and adults that they come in contact with, adults that are already part of their network, such as other adult relatives, neighbors, religious leaders. Informal mentoring are those purposeful relationships that develop within an organizational or institutional context that bring youth and adults together but without a formal or intentional match. And then formal mentoring is that structured, intentional relationship that takes place within a mentoring program. Our presentation today will touch on each one of those mentoring approaches. We will now hear directly from the mentor-mentee duo about their lived experience with mentoring. So again, it's Taisha, who is the mentee, and Mary Ellen, who is the mentor. And
Hello.
we're going to be asking them some questions. Hi.
Hi.
So Taisha and Mary Ellen, can you please share with us how your mentoring relationship developed?
Sure, this is Mary Ellen. Taisha was a young mom in foster care, and at Lawyers for Children, where I work, we represent young children in the system, and at LFC, both a social worker and a lawyer are assigned to work with young youth in care. And I met Taisha about 2 years ago. Part of my role as a social worker at Lawyers for Children is to advocate and voice their concerns and issues while they're in the foster care system. But one of the big things I feel that my role is to be very supportive of this trauma-informed group. So I met with Taisha, and I usually, even though she's out of foster care right now, I do check in with her on a regular basis, probably every other week through phone calls, emails, and texts. We've continued our relationship, even though she's a youth that's been out of care for over a year now.
Hello, Mary Ellen?
Yes.
Oh, okay.
You can hear me, right?
Yes, I can hear you.
So one of the other things, so that's the reasons, that's how we met, Taisha and I.
Okay. And this next question is for Taisha. What were some of the bumps along the way in developing your mentoring relationship?
The main bump for me with mentoring was me opening up and trusting that one person. I would say that was my biggest challenge in the beginning, was to actually open up and see what my mentor had to offer.
Thank you for sharing that. And in what ways has mentoring helped you personally, and how has it helped your child?
Having a mentor has helped me become a better speaker. My mentor has proven to me that people and society can change, and having a mentor has given me more social skills. I am much more professional with my attitude, with the way I look, and everything about me is more professional. And having a mentor also helped me look at things from other people's perspective and look at things from 5 different ways. It also had a great big impact on my child. He feels comfortable. He feels that there is another source for him to come to if anything was to happen. And he is much more educated now because my mentor donates a lot of books to us. So we read a lot. And to me, she's more than a mentor. She's like a fairy godmother to us.
Oh, thank you. That's beautiful. Mary Ellen, how has mentoring and expectant and parenting youth changed your practice?
Yeah, that's a tough question. I mean, as a licensed social worker, there are always the rules of being a social worker and sort of the fine line. But, I learn every day from Taisha and Tavion that one of the most things that they really need is someone to be there for them and to be supportive of their decisions in life, her as a mother, her as an individual. And so, I do go the extra mile, I find. I've definitely connected with Taisha and Tavion for the last 2 years. And, sometimes she just pops into my mind and I'll text her. I've written her cards in the mail to, check in on her, wishing her a good day of school, a happy birthday, or just telling her that she's a great mother and to keep it up. So I have sort of, gone that extra piece as a social worker and working with her.
Great. And Taisha, reflecting on your relationship with Mary Ellen, what do you think are core qualities that all mentors working with expectant and parenting youth should have?
The first quality a mentor should have is a mentor should have a sense of humor. Everybody needs a sense of humor. Everybody needs to laugh. And I say a sense of humor because as a parent and as a parent aging out of foster care, there's a lot of things that can be reported that does not need to be reported. For example, if I say, hey, I'm losing my mind, I just want to bang my head into the wall, people will look at you like you're crazy, but your mentor knows you well enough and would just be like, you're just going through something right now. Let's just find something else to get your mind off of it. So they need to be able to loosen up sometime and laugh a little bit. Another core quality a mentor should have is that the mentor should get to know the mentee first before questions and before even looking at their charts or anything. Just speak to them A mentor should also give a lot of advice, a lot of advice. Every conversation a person should have with their mentor, they should come out with something like, okay, oh yeah, my mentor said, okay, do this. Just some type of advice. Mentor also needs to be honest. The truth hurts, but that's the only way we'll learn. And a mentor also needs to relate and open up and show the mentee that there can be mistakes and that they have seen different things, so they try to show you different things, and that a mentor should be present, not as in, oh, I call you, you're supposed to pick up all the time, but just be present, just me knowing that I know that you're there. And the mentor should also show opportunities. You can't have a conversation with somebody and expect them to do the right thing if there's no opportunities in front of them.
Thank you very much. And lastly, Taisha, I just want to get a sense from you, what recommendations do you have for professionals working with expectant and parenting youth in foster care to create additional opportunities around mentoring? For the system in general, any recommendations do you have?
The main thing mentors should, I recommend mentors have, is to show opportunities to the mentee. Like my working with Mary Ellen, she has opened up me to great opportunities. She's brought in Rachel from Rise, and now I'm a writer from Rise magazine. I am also a youth ambassador for Lawyers for Children. Mary Ellen also recommended me to family psychotherapy with Dr. Kurtz, which is parent and child interactive therapy. So she has opened up me and my child to opportunities and things that we can benefit from, not just for the present, but also for the future.
Thank you very much. And Mary Ellen, also the same question for you in thinking about your experience and any lessons learned. What recommendations would you have for other child welfare professionals around creating opportunities for mentoring?
Yeah, I think on the same line of Taisha, I think, for me, it's just continuing to work closely with them. They're young. We need to take in mind their age and where they are developmentally is a key piece, and sort of their history and their trauma. That all plays into sort of your relationship with the young teen. I also think it's a great opportunity for young professionals in general to get to know their child too. It's a way that you will learn about their parent through the child as well. So that's an important piece of the relationship. And just continuing to support and check in with them would be beneficial.
Okay. Thank you very much to Taisha and Mary Ellen for a very, very insightful discussion on informal mentoring. For me, this conversation really highlights the strength and the utility of informal mentors as a great support mechanism for expectant and parenting youth and their children. I will now turn it over to Barbara and Brenda and their mentoring partners, who will provide us with an overview of Sacramento County's Expectant and Parenting Youth Collaborative's mentoring approach. They will discuss their implementation efforts and some of the initial lessons learned.
Good afternoon.
So Barbara and Brenda, you are both unmuted, and you can begin.
Perfect. Thank you, Lisa and CSSP, for giving us this opportunity to talk about what we're doing in Sacramento County. My name is Barbara Oleachea. I'm with Sacramento County Child Protective Services, and joining me will be Brenda Dabney and Cindy Kane from Children's Law Center in Sacramento. And there's our lovely team on this PowerPoint as well. As you can see, we're small but mighty. Our profile of the EPI that we're served, I'm going to look back at our fiscal year 2014-2015. During that year, we served a total of 111 youth, and of those 111, we had 10 that were identified as fathers and 101 that were identified as mothers. Looking at the numbers, we have done a really good job of capturing in our database system our expectant and parenting mothers, but I think we still have more room to improve on capturing our fathers, because I believe the number that we show, 10, is pretty low and not reflective of what's happening in Sacramento County. And then we have a total of 131 children from these expectant and parenting youth. As you can see on the graph below is the age distribution of our EPI. They range between the ages of 16 to 21, with the largest group being under 20. And the next slide, you'll see the placement setting. So given that the majority of our youth are between the ages of 19 to 21, we see a greater number of youth living independently in what we call a supervised independent living placement. And then the next group is foster family agency certified homes. So we recognize that there is a need for our young folks who are living independently, that they need more opportunities to have a more supportive person in their life. And that we saw that a mentoring program or having some kind of a robust mentoring program set up for our youth will help them in the long run. In the next slide, you'll see again that the outcomes that we're looking at that you saw previously from CSSP, the thriving youth, our goal is that we hope to see that the youth who are connected with a mentor will have an increase in educational success, strong, stable connections, and physical and mental health. And in regards to their nurturing parenting, we also hope to see that their children will then be safe, healthy, and then ready to learn. So our vision is a network of mentoring programs. Our goal, though it might be robust, our goal is to have every EPI youth connected with a mentor that can support them in their development as a youth and as a young parent. Currently, we have 22 youth who are participating in a mentoring program, so we do have quite a ways to go, but we are confident that we can definitely increase those numbers. Our strategy is to develop a collaborative relationship between social workers, lawyers, and existing mentoring programs to create a shared system for our common expectation, recruitment of mentors, referrals, capacity building and support for mentoring programs, and tracking and continuous quality improvement. And we'll go more in depth in these strategies further along in this webinar. So this past year, we were looking at developing our mentoring program, and we were actually initially anticipating developing a relationship with 2 providers. But surprisingly, we had an overwhelming interest among our mentoring community to team up with other mentoring groups to share resources, develop trainings, and work on joint initiatives to help improve the lives of all EPI in Sacramento. And after our initial meeting, we were joined by 2 other providers, which allowed this project to broaden its focus and serve more diverse EPI in Sacramento. And so we have 4 of our providers on the line today. We have Sharina Hardy with Court-Appointed Special Advocate, Rosario Roca with Planned Parenthood, Himal Sharif Zada with True North, and then Paula Birdsong with Precious Ones. So now I'm going to pass this over to Sharina Hardy with Court-Appointed Special Advocate so she can explain a little bit further what their program does.
Hi, everyone. You guys hear me?
Yes.
Yes? Okay. Hi, my name is Sharina Hardy. So for anyone who doesn't know what CASA stands for, it stands for Court-Appointed Special Advocates. What we do is we recruit and train individuals from the community to be mentors and advocates for kids in the foster care system. There are lots of mentoring programs, but we specifically how we're different from other programs is that we deal with court things. So these CASA workers will get to know the youth and build a relationship with the youth, but they will continue to document what's going on. They'll investigate, how is this person doing in school? Maybe the CASA worker needs to go speak with a teacher, or maybe they need to do a home visit with the foster parents to see what's going on at home, or maybe just, talking to the youth. With all that information that they get, they create a report 2 times a year, and they will present their report and recommendations to the court. They're kind of like the unofficial attorney for these youth. They'll make a recommendation based on their, what they've witnessed in these kids' life. And are there any questions that I should point out or answer?
Well, actually, we will have a question and answer session after each of the 4 mentoring partners have presented. So we'll ask that everybody save their question for that time.
Okay, so right now we have about, I would say, 80 to 90 youth on our wait list to receive CASA workers. We just finished a training. Actually, yesterday, 20 new CASA workers were sworn in, so we are looking forward to matching youth. We have, I would say, anywhere between 10 to 15 EPY youth on our wait list at one time, and we are hoping to match them all if they're not already matched with CASA workers.
Okay, thank you very much. And next, I believe that we were going to be hearing from Planned Parenthood about their mentoring, their peer-to-peer mentoring program.
Is Rosario Roca online?
She's online, but we're unable for some reason to mute. So if you're able to speak for her, that would be wonderful.
Yes, no problem. Thank you. So Rosario Roca was going to speak on behalf of Planned Parenthood. So Planned Parenthood has a program called Teen Success, and it's a support group that provides an opportunity for pregnant and parenting teen girls to connect in a supportive environment. So this is a peer-to-peer mentoring model. The participants will receive weekly stipend, a free childcare. They get lots of information and support, and mostly get connected with other peers. That's all I have to say at this time.
Okay, thank you. The next mentoring partner is True North.
Hi, everyone. Can you guys hear me okay?
Yes.
All right, fabulous. So I'm Amal with the True North Project, and one thing that makes us unique is that we, one, focus on former foster youth 18 to 24 years old. True North has 2 primary programs. One of them is our Community Connections program, where we provide workshops, grocery fairs that focus on community connections, housing, employment, legal assistance, health and wellness, enrichment activities. And also our CA4Y program, which we call Community Allies. Those are our mentors. And what's unique about our model is that instead of one person being a mentor to the youth, we find a whole civic engagement group that will adopt one youth for 1 year. So how that would look, for example, is faith-based civic engagement groups, whether it's a church, a Rotary Club, or community volunteers that would team up together to provide mentoring opportunities for one former foster youth. Examples of how this works is we recently connected one youth with church organization, and it gives the youth a sense that there's a community behind them and that they're connected to this community. Our youth needed a laptop for school. The church sprang together and they actually did a collection and they bought her a laptop. One other one even needed a bicycle. Someone in the church actually had a bicycle to give to that youth. On focus with EPY youth in specific, we are starting to train mentor organizations to take on one youth And we actually had our first training last week, and had our first mentor connection as well. So the things that EPY Youth specific is around helping them meet the different needs that EPY Youth might have. How to baby-proof your home, support, connecting them to the community resources that already exist. We believe that there's a lot of community resources here in Sacramento, and sometimes youth just have a hard time navigating them and accessing them. Well, that's where our mentors come in. They would help the youth get connected to those programs along with True North support. And the last thing is as we go through this process, we are going to provide contact-specific training for our mentors, on example, EPY Youth in different ways, just providing them with different knowledge on how to support their mentees. Is that a good overview? Is there something else you guys are looking for?
That was great. Thank you very much. And then the final mentoring partner that we will hear from is Precious Ones.
We currently are serving 12 of the foster youth. As the program was stated earlier by someone who was speaking, thank you for that. We pair our moms with a mentor. We call them a sister friend, so that they can receive direct mentoring and guidance, and most importantly, emotional support. Our biggest piece is making sure that moms are receiving that positive feedback about what they're doing, about what's going well, not looking at all the negatives, but just giving them encouragement and lots of stroking, lots of stroking. We have found that to be our best model, in that we're able to get the relationship solidified so that moms are then able to hear some of the positive information that they need to, and other instruction on what to do to best care for that baby. Our whole goal is to continue that relationship until at least the baby is 1 year old. Sometimes it goes even beyond that point, but just to make sure that that mom has that network of support from not only her sister friend / mentor, but from the whole Precious One community. We are part of Center of Praise Ministries as a program, but we serve people who are not our members, but people who are throughout Sacramento. So that is how our program works, and we make sure that our moms are supported with resources that they may not have, and if they need something, we're going to find it. And then we celebrate, celebrate, celebrate. So that is a quick overview of Precious Ones.
Thank you very much, Paula.
You're welcome.
All right, so let's move forward. So we have common expectations. As we move forward, we met with our providers earlier this year. It was in April, and we discussed about what were some of the common expectations with all the providers. And this is what came about, that EPI and foster care will have priority enrollment in participating in mentoring program if there's a waiting list. That mentoring commitment will extend until the baby's first birthday at minimum. We recognize that all of the providers had a 1-year commitment. So our goal was that our youth would get connected prior to giving birth, and if they are connected while the youth is pregnant, that they will follow along until that baby's first birthday. Mentors will communicate with the youth weekly. That could be done either by phone, by texting, but also have a face-to-face contact at a minimum of once a month. Mentors, and then our last common expectation was mentors will participate in a minimum of 1 joint 2-hour training that is specific to working with the EPI youth. When we met with the providers, it was very clear that they all expressed a need and a desire to have a training for their mentors about this population and working with this EPI youth population. So we have some strategies, and one of them was recruitment of mentors. And that first strategy is to increase the community mentors. We want to increase the awareness of EPI within the mentoring community. So we have actually been working on a common brochure that the providers, that the social workers, as well as the children's attorneys can disseminate this common brochure that describes all the mentoring options, because we recognize that not one program fits for all of our EPI youth. They also want to present to the dependency core partners, which we actually have already done. We did that was last month. We presented at our standing committee and presented with our referees and attorneys about what Sacramento County is doing to address our EPI population, as well as our mentoring programs. We also want to create opportunities for youth spokesperson to share their mentoring experience. And we are seeing that would be an opportunity during the training piece, as well as any ongoing training and support, a supportive setting. We would have opportunities for the youth to speak about their experience. Another strategy is referrals. Every provider tends to have their own referral forms, their own referral process, and we wanted this to make it easy for the social workers, for the attorneys, as well as the youth to be able to get connected with the provider in a timely manner. And so we talked about creating a streamlined process and what that may look like. We discussed about having a shared enrollment form that the social workers and the attorneys can use when they're making that initial referral. All the providers indicated that their referral is that they need to speak to the youth. And so we will have opportunities for somebody at CPS, for example, or the child's attorney who can call in and make an initial referral, but ultimately the youth will have to connect with the providers to complete that referral process. And so we also need to set up a system where we have follow-up to ensure that that connection was made for the youth and the agency. We also did enhanced capacity building and support, and this past year we offered a mini grant. It was a maximum of $4,500 that was awarded to the mentoring programs. This was a one-time investment focused on capacity building that's not intended for ongoing expenses. And we had several different types of requests made from our providers. The common request was training, and training was around ongoing training for the mentors and their facilitators, but also shared training that can be used among the other providers and shared among themselves. There was also support system for mentors. That looked like thank you gifts for the mentors, or a celebration thank you reception for the mentors once or twice a year. And then the last was library of resources for EPI. Those were like baby showers, gift baskets, and other resources that the mentors can share with the youth when they go out and meet with them. Another strategy under the enhanced capacity building and support was a shared mentor training. And this is something that Sacramento County is working on at this time. And it's a 2-hour overview training on working with the EPI, delivered at least twice a year. The expectation is that all of our mentors and potential mentors would go through this 2-hour training before they are matched with the youth. We also would have this training available twice a year or as needed. We also were discussing a train the trainer for existing trainers. That's customizable materials that they can integrate into existing trainings. We have this on our radar to do, but we want to reassess after the 2-hour overview training if it's necessary to also have this supplemental training. The 2-hour training will consist of discussing the developmental needs of our youth as well as the children, but also trauma-informed, focusing on the trauma-informed and how to work with this youth, resources that are available in our community. And a bulk of the training will include a panel of existing current or former foster youth who are EPI. And then finally was the quarterly capacity building sessions. We were wanting to give this opportunity for ongoing training for our mentors to come together that was focused on specific topics that are facilitated by our mentoring agencies, and it gives an opportunity for mentors to discuss their challenges and assess their future training needs. Also, under enhanced capacity building and support, we discuss support system for mentors. We recognize that this is a very difficult population to work with, and sometimes our providers need someone to contact and connect with when issues come about. And we are looking at or exploring ways to maybe set up a support line for them to call with questions and issues. We've identified one person at the Children's Law Center and then here at Child Protective Services, our youth advocate, for someone who they can call. It's a support line, a warm line, someone who they can call to ask for if there's any questions and issues that come about. We also recognize that our providers, our mentors, they need information about the resources that are available in our community. So developing a community of resources that they can draw from at any given moment. Having ongoing monthly supervision and support sessions is going to be really key for our providers to be able to maintain and continue on their work with their mentees throughout the year. We are looking at some kind of web-based communication forum for mentors that they can communicate amongst themselves with the 4 different providers. And then also doing a joint with all 4 providers, doing a joint celebration to acknowledge and celebrate the events with the mentors. The last strategy under enhanced capacity building and support is a library of resources. And this is an opportunity where mentors can check out passes to museums or other community activities. This will be an opportunity for the mentors when they meet with their mentee to have the experience more meaningful, and it'll be learning opportunity when they meet with their mentees. Teachable moment kits. We are thinking that this will be something like a check-off list that they can go over and have tools with them on teaching them, like child-proofing, or when they want to go grocery shopping, how they can utilize the very little money they get on a monthly basis. So to creating a grocery shopping list and then actually going out and shopping with them. Could also be like making a dinner, what kind of items they'll need to make that dinner, to make something healthy for themselves and their child, playing with their child, as well as reading to their child books and materials. So these items under the library of resources are something that we are looking at developing later in this year, but we are really excited because we think this will be a really good resource for our mentors to use at any given moment when they meet with their youth. And then lastly is the tracking impact and CQI. We want to have a shared outcome, and all of our providers, they do something very different. They offer something very different, but what they do have in common is that each of our providers develop a specific goal, and we want to make sure then that what we track is comparable. So we have a quality of the match. We want to develop a satisfaction survey that both the mentor and the mentees would do after they've been matched, and then a follow-up survey to see how that match has been going. And then we are looking at the outcomes for the pregnancy and youth. Did they have a healthy birth? Youth outcomes, was there any delay of subsequent pregnancy? Their education or their employment, did they complete that? Are they enrolled? And then we're looking at child outcomes as well. We want to make sure that their children remain safe and that they don't come back into, or they don't come into the system under dependency as well. So lessons learned. Looking back these past few months and meeting with our providers, there was a couple that really popped out in our mind. Was supporting the mentor to support the unique needs and expectant and parenting needs in foster care. We have 3 providers that are already working with this population, and they've expressed that, or they were surprised. They didn't realize how hard and difficult it is to work with this population and some of the issues that come along. And we realized that they desperately need the training and that support, that ongoing support early on. And they are also recognizing that they really need that support. They needed it yesterday instead of tomorrow. And then rallying partners around common expectations and results. As I mentioned earlier in the previous slide, our providers are so different, and they have different requirements and expectations amongst their own program. So we want to make sure that we are all wanting and looking at the same results for our youth and their children. And so that is something that we'll be working on, is how can we develop a common, having common goals and data that can show the positive work that all of our providers are doing for this population.
Thank you very much, Barbara, for a very informative presentation, particularly around your coordinated efforts with the common expectations, the shared training, and the referral processes amongst all the mentor providers. I think what struck me in listening to your approach is the idea that all youth should not be served in the same way, and that the mentoring, the different approaches that you've outlined, whether it's peer-to-peer, whether it's wrapping the youth with a group of people that are within the community, should really be tailored to their unique needs and circumstances. So thank you again for the presentation. At this time, we're going to open it up again for questions and answers to the presenters. As the questions are coming in, I actually have one for the mentoring providers. If you can just talk with us a little bit more about what you've learned about building trusting relationships, particularly with expectant and parenting youth in foster care, as they've previously experienced relational disruptions in the past.
Hi,
this is Paul.
Go ahead.
So sorry.
We'll go with Paula first, and then we'll go to Eric and Mike.
All right, this is Paula with Precious Ones. What we are learning is that the population, our expecting and parenting youth, of my entire population of 70 moms that we're serving, that is my most challenging group. And I'll say that in a loving way, challenging because of humongous trust issues, because of working with different systems. Once we finally do establish a relationship, they're absolutely amazed that we are not reporters. We're not taking lots of notes. I'll give you an example. One of our young ladies said, I like the fact that my mentor does not come in with a clipboard or anything to write with. She just comes in and changes the baby if the baby is needing to be changed and I'm trying to wash the dishes. So I think it was just breaking down those barriers that they assumed would happen, that we were somehow coming in just to point fingers, and once they realize that we're not, the relationships then could develop and move from that point. So that's what we've learned as we've gone forward.
And thank you. We'll go to Herman.
Yes, actually, I meant to ask the mentor and the mentee that spoke earlier a question related to FIPS, and I was on mute, so this is a good question. Our organization, trust, again, is like the biggest thing. They've had a lot of people come in and out of their lives, and one of the questions is, like, how long are you going to be around? And we're very clear that even though we talk about a formal mentorship approach, that it doesn't just end, that they can continue it after that on an informal basis or start up again on another formal basis for another year. So our intention is to have them connected to their community because they're going to grow up here one way or another. The question that I had for the panelists earlier is just regarding the father's role. I don't remember if you guys touched up on that at all, but have you guys had any experiences with that, or what has been your experience with father involvement in the mentor experience?
I think that question, oh, go ahead.
I was going to answer. It's been limited. and that is definitely a goal of increasing that. But of the few, we had 3 who actually showed up at our last event, and we celebrated big time. I mean, my goodness, you would have sworn they were king for the day because we made such a big deal. But it's a struggle because of the relationship with the mom and maybe the family members, extended beyond that point. The dads feel that they need to remain on the outside. So if anyone has some great ideas to break that barrier, we'd love to know. But it is something that we are continually trying to improve upon.
Thank you for sharing. Yeah, we're thinking about father support groups or something, but I was curious to hear about other people as well. Thank you for sharing.
Sure, you're welcome.
Are any of the other presenters or any of the audience members would like to add of their experience in terms of engaging fathers in mentoring?
At CASA, we do not have any fathers. We tend to get the mothers referrals, but we know they're out there, and so we have, brought up conversations to get more engagement from foster youth that have children. So, yeah, this is a topic for a discussion for CASA.
Thank you very much. Another question that I had for the mentoring providers, in your role as mentors, what are the most effective ways to balance your goal setting and your guidance and your support with expectant and parenting youth? Have it be a balanced approach that focuses on, normal, typical adolescent development, things that they would want to do as adolescents, with being a parent. And if you could share with us, some of your experiences in helping them to balance those two things.
What I have asked for all of our mentors to do is to stress to our young moms is that first and foremost, your job now is mom. I get that there's always the draw to do some of the adolescent things that you typically would be doing if you were not a mom, but those things have to be secondarily. If the mom duties are already taken care of, baby's good, there's find those opportunities, but they will not be first and foremost, because you're first and foremost always 365 days, all the time, a mom. And so recognizing that is your new world, that is the biggest challenge sometimes, but it's also an eye-opener. And let them know that there are ways to still have some outlets, but they're fewer and secondarily to your primary role of caring for your child.
Thank you for sharing that. The research that we've done and the work that we have learned from in terms of implementing programs and policies for expectant and parenting youth in foster care really leads us to the need to address both the developmental needs of those youth as adolescents and really create opportunities for them to experience what normal adolescence could look like, and being able to be a nurturing parent and provide that protective environment for their child. The research really points to the importance of having both and being able, as challenging as that could be, but being able to help the youth manage both aspects, that one should not completely cloud the other. So I'm wondering if there's other providers out there that have other insights or learning to share in doing that.
With True North, yeah, I mean, we wanted to, I think it's just echoing other people's, but also to teach them those skills that they need to learn. You guys we mentioned baby-proofing the home, for example, or how to balance your time. The youth that we just met with, the EPY youth, just said, diapers are expensive. I didn't realize how expensive those things are. And how do I balance my budget every month? And just helping them with real life stuff like that as well. So getting them to take that role and embracing it is very important for us.
There's another question for the Sacramento team. You spoke about sort of targeted recruitment and messaging within the community to increase the awareness for the need for mentors for expectant and parenting youth. Could you just tell us a little bit more about what are the selling points? What are you using to get the buy-in from community members?
From community members?
Yeah.
Well, at this time, that would be the mentoring agencies on their what efforts they might be doing internally to recruit.
Yeah, I can share ours. I mean, we do presentations to different civic engagement groups, churches. We meet with them individually to see if they might be interested in mentoring a former foster youth for a year. We also, at our events, speak a lot about our mentoring program and reach out to the folks that attend our events. We have one coming up this Friday, a big golf tournament, and that's one of our focuses, EPY youth, and telling them why it's important to support these youth, and if they could reach out to their network and see if there's maybe one person that has a church or wants to volunteer and help out. So that's the ways that we go about recruitment.
Thank you very much. And then finally, if there are any insights on mentor retention and the matching process.
For CASA, we do have an 18-month commitment, so we, make sure that it's clear to all of the volunteers coming in that they, we do expect them to stay and to take on a case right away. They go through a training and then have an initial and a interview. And so we kind of instill it that this isn't temporary, and that has really helped CASA have a good success rate with our volunteers. And sometimes if the youth has a case where they're being adopted or they don't want a CASA, we have a lot of CASAs who will, take on another case. Our trainings in the beginning and our relationships with the case supervisors, between the case supervisors and the CASAs, has really helped us keep a good number of volunteers and CASAs. Did you have any specific?
Oh. Okay. And we have Go ahead.
Oh, did you have any specific questions about the referral process?
No, there were no specific questions that came up in regards to that.
I did want to say, this is Barbara from Sacramento, how we identify EPI youth who are interested in mentoring. So earlier this year, we did a survey with our youth who were placed in a whole family foster home. And one of the questions we asked at the end is if they were interested in having a mentor, and those who indicated that they were, we personally refer them to a provider. And after doing that survey, we realized that maybe we need to personally ask all of our youth that we have who have an active case if they are interested in a mentor. So that's actually what we did. We would connect with the social worker as well as calling the youth themselves, asking them specifically if they're interested in a mentor and describing the different providers that we have available.
We have one final question for the Sacramento team, which is, what are your plans for sustainability of this mentoring network?
This is Brenda. I can chime in and just talk a little bit about, we had talked about how to prepare the mentoring agencies for sustainability after our work with them is done. And so some of the things that we had been working toward were creating like a warm line support call that would be available to them when they had questions about different issues to draw a map of community resources that they could continue to build upon long after we're gone and provide that to their mentors now and in the future, to help them start setting up monthly sessions, support sessions with their mentors and their program supervisors so that they could continue to encourage mentors and talk about difficult issues or cases that they were encountering, to just provide a structure for them to be able to continue to sustain themselves and to build more interest in the work that they do. We're also hoping that we are able to put a lot of our resources and the work we're doing online as well that would be accessible to the mentors as well as the general public for sure.
Thank you very much. So we have heard a lot of great information, and we hope that it has ignited your thinking on creating opportunities for mentoring. This is the peer discussion portion of the webinar, although we sort of started that earlier, which is really great, where you can share ideas and ask each other questions. We have some questions up, as you can see, to kind of guide our discussion, but you can feel free to add additional questions as well. Just to avoid any further audio problems, if you can please type in what your question is or what you would like to discuss or an idea that you have, and we will read that out loud on your behalf. So if we can start with the first question, we want to get a sense from everybody that all the participants that are currently on, how is mentoring for expectant or parenting youth currently supported within your child welfare system or within your program and agency if it's not directly related to child welfare? So we'll give some folks an opportunity to type in their responses. All right, all of a sudden we have a quiet crowd, so maybe we can get things started up with the second question, which is again open to everybody. So given that most youth have natural or informal mentors, what responsibility or obligation does the child welfare system have to make sure that these relationships are positive and safe? And I would like to ask some of our presenters to chime in on this as well.
You know, because Barbara and I might have slightly different answers for this too. Speaking from the child advocate's perspective, I think that, you know, obviously as lawyers we have an obligation to our clients to ensure that we help them navigate new parenthood in a way that is satisfying to them, but we obviously also have a moral obligation, I believe, to ensure that they are doing the things they need to do to keep their children safe. And so it's important for us as advocates to work as closely as we can with the agency and with other service providers to make sure that there are lots of other people consistently checking on the baby, providing support and encouragement to our clients in a supportive way, and really working with our clients to try to recognize signs of concern or danger when they could arise in their home so that they feel comfortable reaching out to people. But certainly this work has brought many of us together to talk about our desire to make sure whatever we do, we keep these babies in a safe place. Barbara, do you want to add anything to that?
No, I think you did a really nice job, Brenda. You know, what else really popped in my mind as well is the AB 2668, which went into effect on July 1st. And that is an assembly bill that provides additional payments for our parenting non-minor dependents who are living in a supervised independent living placement, or SILPs. And I believe that majority of their mentors, that those will probably come from more of the natural, informal setting mentor, and the department will have an obligation to make sure that that these relationships are positive and safe, and we would have to be doing more of an assessment of background to make sure that they will be able to meet the needs for the youth as a mentor, and provide that service that the youth will need.
Thank you very much for sharing both of your perspectives. Is there anyone that would like to chime in? Hermala, you are unmuted, so you don't have to type in the response. You are able to speak.
Oh, that's so much easier. Thank you. I was typing and typing away. We're still on question 2, right?
Yes, we are. You're paying attention.
So one thing, again, just going back to the sense of community for us, is that it's not just on one mentor. It's there's a group of people. So making sure, because sometimes mentors worry about the time commitment wise, and this really helps them in that there's a group that helps mentor the youth. And as far as TNP goes, we do quarterly check-ins. We have a, well, that goes to the third question. So yeah, that's it for that one.
Thank you very much. And we can actually move into the third question, which is what measures are you using or would you suggest using to evaluate effectiveness of mentoring? I think this is a big question that a lot of programs out there are grappling with, particularly around trying to measure the quality of the mentoring relationship and what should be the indicators that will tell you that this is a quality mentoring experience as opposed to the number of activities or the number of times they meet per month.
So initially, we start off with just giving the mentee and the mentor what we call what's called a life book for transitional aged youth, and kind of like a little tiny homework assignment for them is to go back and for the youth to check off what areas they feel like they need support in, and then we sit down and develop a intake survey and then a pre and post survey, basically at the very beginning and at the end to see what they've accomplished and what knowledge they've gained. Quarterly check-ins as well to help them guide their plan, for Trenor staff to help them guide their plan. And we encourage at least weekly check-in and at least 2 times a month face-to-face with the youth member.
Thank you. I want to give people another minute, to those who are online, to type in any feedback, ideas, or questions that they have. Okay, we will move forward with this presentation. We would like to encourage all of you to please keep in touch with us. You can visit our website where you can find an archive of our newsletters, webinars, and a wealth of resources and research and policies and other information. We also want to hear from you and keep the conversation going, and you can do that by joining our collective and also our private Facebook group. If you have any questions, ideas, or information that you would like to share with us in the collective, please email us at epyinfo@cssp.org. Following the webinar, you will receive a brief evaluation survey, and we appreciate your feedback on the webinar, as well as additional topics that you would like to address that will greatly help us in planning future webinars. I want to take a moment to apologize for the technical difficulties that we experienced on the webinar today. A special thank you to all of our presenters, to CSSP, and to the Annie Casey Foundation, and also to Alexis for helping manage the webinar.